Hello friends, now we'll discuss the recent paper of INI-CET, that is INI-CET May 2025 Microbiology recall we are doing up, and this is the recall. They are not the exact questions, so some obviously mistakes might be there. You can tell up in the comment section or you can mail up that these particular things were not there and which as per you was there. So according to that we will change up the question in the later form. So the first question is, an HIV positive patient is there, presents with dysphagia and odynophagia. Okay, difficulty in swallowing, difficulty in eating. These particular HIV positive patient is having. Esophagus shows whitish plaques. When the esophagoscopy is being done, that shows whitish plaques. What is the most likely cause of the following? So obviously there is a history of HIV positiveness, one thing, that is having these problems of dysphagia or odynophagia. Okay, and when you have done the esophagoscopy, you could able to see the whitish plaques. So obviously they are pointing towards what? They are pointing towards the infection of Candida, and mostly which Candida? Candida albicans. Okay, so out of these particular four options, which one correctly describes of the Candida? Budding yeast cells with pseudohyphae. Yes, that's true actually. The thin septate hyphae with acute angle branching. We are talking about what, guys, here? We are talking about the Aspergillus. Okay, and the Aspergillus is having what? Aspergillus is having a dichotomous branching, having an angle of 45 or 60 degree. Acid fast bacilli, it is not so. Giant eosinophilic cell with granuloma, that is not so. It is not a typical picture of that particular stuff. So obviously the answer is A, that is the budding yeast cells with pseudohyphae. And what is pseudohyphae? Pseudohyphae is when these particular yeast cells, they join up with each other like a chain. That is what is termed as a pseudohyphae. Fine. And what is Candida? Actually, guys, Candida is yeast-like. And why we call it yeast-like? Because it sometimes it presents like a yeast and sometimes with a pseudohyphae or true hyphae. Now, second question is, which I have told up in my classes also, that this question will be asked for sure because it is already being asked in one of the exams, and high probability becomes when something is there in another exam, there is a very high probability it can come in another stuff. So that is regarding the Kanagawa phenomena. So guys, what is Kanagawa phenomena? And it is being observed on Wagatsuma agar. So Kanagawa phenomena is being shown up by which organism, guys? It is Vibrio parahaemolyticus. Vibrio parahaemolyticus is around how much percent halophilic? It is around 7% halophilic. Okay, that is 7% halophilic is Vibrio parahaemolyticus. This organism is capsulated. Okay, and it is bipolar stained. Bipolar stained. And as it is halophilic, so when it grows up on this special media named as Wagatsuma agar. What is Wagatsuma agar? In this, there is a high salt content. Okay, in this particular agar, it shows up a phenomena, and the name of the phenomena is what? Kanagawa. What is Kanagawa? It is beta-hemolysis. In fact, on this Wagatsuma agar, it produces enhanced beta-hemolysis. So if somebody asks you that what is Kanagawa, that is termed as enhanced beta-hemolysis. It is termed as enhanced beta-hemolysis, and this is observed on which particular agar, guys? Wagatsuma agar. Okay, now talking about the third question, which of the following is not a dimorphic fungus? Okay, first of all, you should know what is dimorphic fungus. Dimorphic fungus is which shows the different forms based on the temperature. At 37 degrees centigrade, that particular one is what? And at 25 degrees centigrade, that particular organism is what? At 37, that behaves like a yeast, and at 25, that particular fungus behaves like a mold. At 37 yeast, at 25 mold. How to remember? I told you 25 karat gold is mold. So 25 degrees centigrade, that is the mold. 37, it is yeast. So that is termed as dimorphism or dimorphic fungi. Now, they does certain diseases obviously which are by the name of these fungus only. And we have a mnemonic for that, you know, HSBC. Please try. Okay, you should try which particular international bank services? HSBC. HSBC Please try. And what is there in this HSBC? Please try, guys. So these are the various dimorphic fungal diseases name. The first one is histoplasmosis. The first one is what, guys? Histoplasmosis, which is also termed as Darling's disease. Second one is termed as sporotrichosis. Okay. Third one is termed as that is blastomycosis. C is coccidioidomycosis. Okay. P is paracoccidioidomycosis. T is telaromycosis. So these are the various dimorphic fungal diseases which are there, done by the obviously dimorphic fungi. So there was a question regarding that which of the following is not a dimorphic fungus. So obviously Histoplasma capsulatum does, histoplasmosis, so that is there. Coccidioidomycosis does coccidioidomycosis, so that is there. Cryptococcus neoformans is not there in the list. Okay. And Telaromyces marnifi, please try. The last one is T, telaromycosis. So that is also there. So obviously the answer is Cryptococcus neoformans. But what is Cryptococcus neoformans, guys? It is a true yeast. It is a true yeast, is always remain in the form of a yeast. That is what is termed as true yeast. Is it fine? Now coming to the next question. The HLA mismatched in organ transplant will not cause a problem in which particular disease patients? So HLA mismatching is one of the common causes of organ rejection, okay, in the transplants. So which particular syndrome, if the person is having, will not develop this organ transplant rejection? The answer is Behr lymphocyte syndrome. This question came in the exam, Behr lymphocyte syndrome, and basically there is a defect in what? The genes of the MHC. And what is MHC? Major histocompatibility complex. Okay. BLS1 is there, BLS2 is there. So Behr lymphocyte syndrome 1, Behr lymphocyte syndrome 2, they are present. And basically they are the part of a SCID, that is severe combined immunodeficiency. And in them, there is a problem in what? There is a mutation actually in the genes of the MHC. Fine. Besides that, you should know something about these other names also. Job syndrome. In the Job syndrome, what we have, there is an increase in the IgE levels. Okay. Along with that, there are recurrent staphylococcal cold abscess formation, which is characteristic of this Job syndrome. And it comes under what? Defect in the phagocytosis. Okay. Regarding the Chidek-Higashi syndrome. In the Chidek-Higashi syndrome, what we have, there is a defect in the melanosomes. And because of that, there is a decreased melanocyte production. And that leads to vitiligo-like features in this Chidek-Higashi syndrome. And this also is a sort of what? Disorder of phagocytosis. Fine. Wiskott-Aldrich syndrome. Wiskott-Aldrich syndrome is a triad. And this triad is RET. And what we have in this RET? The R stands for recurrent infections. Again and again, the infections, they happen in this particular one. That is termed as recurrent infections. E is eczema. And T is thrombocytopenia. Thrombocytopenia. This is what is termed as RET. Recurrent infections, eczema and thrombocytopenia. These are the triad of the Wiskott-Aldrich syndrome. And this is a sort of a deficiency which is both B and T cell types. Now, coming to the next question. Which helminth is there which most commonly causes autoinfection? Okay. So if you remember, guys, for the autoinfection, we have a mnemonic which is being copied by everybody else also. So that is chest. And in this particular mnemonic which undergoes autoinfection, chest, the C is Cryptosporidium parvum. Okay, what is C? Cryptosporidium parvum. Another C is what? Capillaria philippines. That is the another C. Okay. H is H. nana. E is Enterobius vermicularis. S is Strongyloides stercoralis. And T is Tinea solium. That is pock tape form. So all these are there which associates with auto-infection. Now, Strongyloides stercoralis is there in the options. Ankylostoma duodenale is there. Ascaris lumbricoides is there. And even H. nana is also there. So if you go for this particular mnemonic, you can observe that this is there and this is there. Now, if both comes in the exam and they ask for the single best answer, so you will go for what? Strongyloides stercoralis. It's very common in the immunocompromised fellows, and this definitely does more autoinfection rather than the H. nana because it associates with external autoinfection, internal autoinfection, both. So the better answer will be what, guys? Strongyloides stercoralis. And in the HIV positive patients, this Strongyloides stercoralis does what? Hyperinfection syndrome. And this hyperinfection syndrome is what? In which CNS and visceras, they are involved up, and that leads to death even. So if in the same options, 4 options, if 2 are there from this chest, you have to observe that which one is more associates. And in this particular stuff, obviously, if it is not like a 2 options correct question, then you have to choose up the better answer. The better answer is what? Strongyloides stercoralis. Is it fine? Now, which protozoa have more than 2 morphological forms? So 2 morphological forms means what? Which have cyst and trophozoite. Okay. Actually, not more than 2. In fact, which have 2 morphological forms. That would have been the question. Not more than. More than also is there, actually. But which protozoa have 2 morphological forms? I suppose that was there. And if you think otherwise, like other way around, that this was not there, you can tell what exactly the question was. So Naegleria fowleri, which is termed as the free-living amoeba, exists in the form of what? Cyst, trophozoite, and amoeboid forms also. Okay, Acanthamoeba, there is a cyst and trophozoite. Trichomonas is one of the vaginal flagellate which have only trophozoite. There is no cyst, and this question have been repeated again and again, and you should also know that there is no cyst in the Trichomonas. As far as the Giardia is concerned, this also have C and T, that is cyst and trophozoite, and the trophozoite is famous of Giardia, that is having 4 pairs of flagella, having a tennis racket appearance, okay, or teardrop appearance, having 4 pairs of flagella, falling leaf-like motility. So what is the answer which have 2 morphological forms? So guys, obviously the answer is first, okay, first, then second, and then fourth. So first, second, and fourth will be the option. Answer is B in this particular regard. Now, next question, which of the following stains is not used to identify organism in a post-renal transplant patient? So in a post-renal transplant patient, obviously, which sort of infection will happen? Opportunistic infections will happen. Okay. And mostly that will be fungus, if at all the question goes like that. Okay. Because fungal infections, they are common among whom? Immunocompromised individuals. So obviously, if it is a fungus and the patient is having a post-renal transplant period, so obviously GMS is one of the stains which can be used for what? Pneumocystis carni or Pneumocystis xerovesi. Okay, which leads to pneumonia. Fontana-Masson stain or Masson-Fontana stain or trichom stain, that is used for phuoid fungi. Okay, phuoid fungi. And what is phuoid fungi? They are darkly pigmented fungi. Periodic acid skiff, that is termed as PAS. That is also there in this particular one. And you know that it comes in the list of fungal stains. Congo red stain will be the odd man out here because that is being used for amyloidosis, not for the fungal stuff. So basically what they want to ask indirectly is for the fungal stains, And the fungal stain is GMS, that is Gomori methamin silver, used for pneumocystis xerovici. Fontana mason or Trichom fontana mason, that is for the pheoid fungi, which are also termed as demataceous fungi, which are also termed as what, guys? Demataceous fungi. Periodic acid skiff, that is PAS, which is not used, Congo red stain, because it is for what? Amyloidosis. Okay. Now, coming to the next question. A child presented with intense perianal itching. His mother complains of seeing thread-like worms in the perianal region. Itching is there, worms are seen in the perianal region. Scotch tape method was used to collect the stool sample from the person. Okay. And that particular one showed what? Eggs. So this particular Scotch tape method, also known as NIH, National Institute Health Swab. Okay, NIH swab. And this particular image which is there in this is typical of whom? It is typical of Enterobius vermicularis. Enterobius vermicularis, which is also termed as pinworm, threadworm, or seatworm. Pinworm, threadworm, or seatworm. These are there in this particular regard. Okay. Pinworm, threadworm, and seatworm. Okay. Important is this particular egg which is there is non-bile stained and it looks like a plano-convex. It looks like a plano-convex. And plano-convex means what? It looks like D, like this. This is termed as plano-convex. Okay. Now coming to this. Identify the following antibody. So guys, this particular antibody which we are seeing in this is a dimeric stuff. And this dimeric stuff is which one? IgA. Okay. And that is being joined by which particular chains? J chains. And you know the IgAs are two types, IgA1, IgA2. IgA1 is present in serum and IgA2 is present in secretions. And they have the secretory component, and along with that they have the joining chains also. Which other immunoglobulin is there which is having the joining chains? IgM. How to remember? M and A both have joining chains. Okay, M and A both have what, guys? Joining chains. So you have the joining with your mark. So joining chains is a feature of M and A, IgM and IgA. Now, which of the following methods is commonly used for culturing the Toxoplasma gondii in the lab settings? I doubt this question has come or not, but still, if it are, these were the options and this question came in the exam, then the best answer would have been peritoneal inoculation in the mice of a particular secretion or a particular tissue. You can inoculate up into the peritoneum and then you can culture up the Toxoplasma gondii. Okay. And another version which I've seen up in the recalls of another platforms was that which particular one is not infective. So guys, for this, the infection happens by three routes. And it happens by what? It happens by one, sporulated oocyst. Means simple oocyst is not infective. It should be sporulated oocyst. Means what should be present in that? Sporozoites. Okay, what should be present in that? Sporozoites, and that is what is termed as sporulated oocyst. And how does the sporozoites are produced? They are produced in the soil. So this is one of them, and how it is being eaten up with contaminated food and water. Another one is tachyzoids. And what is tachyzoids? Rapidly dividing forms. They are termed as tachyzoids. And how does they being transmitted? By the blood transfusion. Okay, suppose you have taken up without checking from a poor blood bank, you have taken up the blood for the transfusion because it was cheap as compared to the other one, then again the person can have the infection of Toxoplasma by the tachyzoids. And tachyzoids, this particular name tachyzoids, tachy means what? Rapidly dividing forms. Okay. Other than that, you have the third thing that is termed as bradyzoids. Bradyzoids is what, guys? Brady means slow, slowly dividing forms. And how does we get the infection of slowly dividing forms. The infection of slowly dividing forms happens to be due to the eating up contaminated meat with the bradyzoids. And that particular meat is having what, guys? Tissue cyst. And that particular tissue cyst is holding up what inside? It is holding up these particular bradyzoids. These particular bradyzoids are there within this particular tissue cyst. So these are the three important ones by which the infection of toxoplasma happens. The first one is sporulated oocyst. Second one is tachyzoids. And the third one is bradyzoids. The third one is what, guys? Bradyzoids. Now, match the following diagnostic test with the organism they help to identify. CAM test. CAMP CAM test. Christie-Atkins-Munch-Peterson test. That is being used to diagnose which particular bacteria, guys? Group D Streptococcus. The other name of Group D Streptococcus is what? Streptococcus agalactia. Allic gel precipitation test. It was used to be done, and it was being done for what? Corynebacterium diphtheria. It is a precipitation test, as the name suggests. Q-lung reaction. It is a capsular swelling, and this capsular swelling is for Streptococcus pneumoniae, that is pneumococcus. It is serological reaction in which capsular antigen binds with the capsular antibody, and there is a capsular swelling. That is termed as Q-lung reaction. Then you have this VDRL test. VDRL test stands for what? Venereal Disease Research Lab test. And this is being done for what, guys? Syphilis. And syphilis is being done by which organism? Treponema pallidum. It's a slide flocculation test. Slide coagulase test. Slide coagulase test is for Staphylococcus aureus. And this is one of the tests which determines the pathogenicity of the Staphylococcus. McFadden's reaction is another capsular reaction, and it is used for Bacillus anthracis. So which particular one goes as per the options? The answer is A. First is D. CAMP is Group B Streptococcus. Second is B. Allic gel precipitation test. Corynebacterium diphtheria. Toxin, antitoxin, precipitation lines. They are produced up. Q-lung reaction. Q-lung reaction is capsular swelling. VDRL test. Fourth, that is Treponema pallidum. It is one of the best tests for the prognosis of syphilis. Okay, but it is a non-treponemal test. And VDRL CSF is the investigational choice for what, guys? Neurosyphilis. Slide coagulase test. The slide coagulase test is used for Staphylococcus aureus, and that determines what? Pathogenicity. McFadden's reaction. The McFadden's reaction is another capsular staining, and that is mainly used for the Bacillus anthracis because the capsule is stained up with what? Because the capsule is special and the capsule is polypeptide. Otherwise, mostly capsules are what? Polysaccharide. So, sixth answer is E, that is Bacillus anthracis. Now coming to this, I don't know whether it was there or not, but it was a very good question, if at all it have come. Which of the following methods can be used to identify the different strains of the same species? Strains. Strains you get from the different locations, like from a certain center you have got a particular strain, from a certain hospital you have got a particular strain. So that is what is termed as strain, but the species is same. That is Mycobacterium TB, if we take the examples of this, and they have asked regarding that only, Mycobacterium tuberculosis. So which of the following methods can be used to identify the different strains of the same species? So answer to this question is, guys, all. C. C is the answer. You have to go for the restriction fragment length polymorphism to find this particular entity. You have to go for chromosomal mutation detection. You have to go for this oligotyping. And there is one, the latest one, that is termed as multiple interspaced repetitive unit typing. That is termed as MRU VNTR. Okay, so these are the various different things which you can do to find out the different strains of the same species of Mycobacterium TB. Okay, now what are they? 1122 lines regarding them. The restriction fragment length polymorphism. Okay, this particular method analyzes the differences in the length of the DNA. As the name suggests, restriction fragment length polymorphism. So there is analyzed differences in the length of the DNA fragments produced with the help of what? Restriction enzymes. So basically what you measure up the length of the DNA fragments in that. So this is the crux on which you have to focus upon. This particular restriction enzymes you already know, they cut the DNA at specific sequences, and that's why they are termed as restriction enzymes. By comparing the resulting fragment patterns, the researchers can differentiate between the different strains of the same bacteria. Okay. Then this chromosomal mutation detection. This particular approach focuses on identifying the specific mutations, as the name suggests. So it determines what? Specific mutations in the bacterial genome, which can differentiate the different strains of the same organism. And these mutations, they can occur due to the various genes, okay, because the various genes are involved up in the mutation, including those related to the drug resistance also. That can also be detected up in different strains by the method chromosomal mutation detection. Then this particular one, SP oligotyping. So this technique detects the variations in the specific region of the Mycobacterium TB genome. Specific region, that is important. Again, you are targeting certain regions to find out the difference in the strains. And this is termed as direct repeat regions. So in the SP oligotyping, you have to focus upon what? DR, that is direct repeats. By analyzing the presence or absence of different spacer sequences within the DR region, the researchers can differentiate the different strains. So basically, here the catchword is DR. Then comes this MIRU, VNTR. Multiple interspace repetitive unit variable number tandem repeats. That is the full form of MIRU, VNTR. If this have not come in the exam, it will come. Okay, definitely one day it will come. So you should know at least what it is. This method utilizes the repetitive DNA sequences, because what we are doing in this only, repetitive DNA sequences, the name also says repetitive, in the bacterial genome, which vary in the number between the different strains. By analyzing the length of these repeats, the researcher can distinguish between the various strains. So in total, out of these particular 4 options, that is the RFLP, restriction fragment length polymorphism, chromosomal mutation detection, SP oligotyping, multiple interspace repetitive unit typing, that is MIRU, VNTR, all they can be used to find the different strains of the same species of Mycobacterium TB. So all they can be used to find the different strains. That's my answer, if this is the question. Now, identify the organism by this particular test. So guys, this is blood agar, and in between they have streaked up the Staph aureus. And you know the Staph aureus is a beta-hemolytic guy. So it produces beta-hemolysis. And whenever the beta-hemolysis of the blood happens, there is a release of X and V, that is hemin and NAD. And regarding that particular streak, the colonies of Haemophilus influenzae, they grow in shape, they grow in size actually. Okay, better growth happens up, and you could able to appreciate the shape also of the colonies well around this particular streak. So, and this particular phenomena is termed as satellitism, and satellitism is shown by which particular one? It is shown by the Haemophilus influenzae on which particular media? Blood agar. Okay, and why does it show that? Because Haemophilus influenzae loves to grow on chocolate agar, and where it finds the chocolate, real chocolate, around the streak. Because whenever the beta hemolysis happens, XNV is released, and XNV is what? Chocolate agar. So it loves to grow around this streak, and from distance when you see them, they look like a satellite, and that's why the term is named satellitism. Okay, so satellitism is shown by which fellow? Haemophilus influenzae. Now, I don't know if this question was there or not. If at all, it can come again. How many PCR cycles are needed to produce the half of the amplified DNA, which is being produced by 27 cycles of PCR? Means this PCR cycle, this particular amplification of PCR happens to be in how much cycles? 27. Then half of the amplified DNA after these 27 cycles will be produced in how much cycles? So in every cycle there is a doubling. So in the 27 cycles, the full amplification have happened up. So obviously the doubling, doubling will happen before that. Like suppose in the 26 cycles, it is half. It will be doubled to the full in the 27th, because they are asking up that how much PCR cycles are needed to produce half of the amplified DNA, which is produced by 27 cycles. This amplified DNA is produced by 27 cycles, means 27 cycles are in total. How many cycles are there which produce half of it? So obviously in every step, doubling is happening. So just one cycle before, it was half. That is in 26 cycles. So that's why the answer is 26 in this particular one. That is regarding the PCR. Now, regarding this particular statement, that which one is the correct one? So we have, guys, Wheel-Felix test is used for typhus fever. Yes, Wheel-Felix test is a test which is the heterophile agglutination test and used for typhus fever. OXK is strongly positive for script typhus. Important. In fact, OX19 and 2, they both are positive for epidemic typhus and endemic typhus also. So that is the correct statement. Vidal test is done in the first week of typhoid fever. No, guys, it is being done in the second week, and everybody remembers it by a mnemonic BASU. That in the first week it is blood culture, then agglutination, which ought to happen the Vidal test in the second one, then the stool culture, and then the urine ELISA and urine culture also you can do in the fourth week. The standard agglutination test for brucellosis, SAT, which shows up which phenomena, guys? Protozoan phenomena. Microscopic agglutination test done for leptospirosis. Yes. MAT is also, another name is MAT, and macroscopic is also there. Better one is microscopic agglutination test done for the leptospirosis. And if you remember my mnemonic, a cat is sitting on a mat. Cat is sitting on a mat, and you have MBL. MBL. MBL means the cat is for cold agglutination test, mycoplasma. SAT is for standard agglutination, brucellosis. MAT is microscopic agglutination test, leptospirosis. Okay. So obviously the first statement is correct. The first is okay. Second is not correct. Third is okay. Fourth is okay. First, third and fourth, they are correct. Okay. First, third and fourth in a single question that have asked up 3-4 reactions. So like this, the questions are coming. So you should be well prepared for the whole theory. Okay. So first, third and fourth, they are the correct options here. Then coming to this question, the most common HPV serotype associated with human cervical cancer is which one? The answer is 16 and 18. Which 16 and 18? HPV 16 and 18. Human papillomavirus 16 and 18. They are the ones. 31, 33 also does. The most common is being asked. So that is the 16 and 18. 6 and 11 associates with what? They associate with genital warts. And genital warts are which one, guys? Condyloma acuminata. Okay, Condyloma acuminata. And they associate with laryngeal warts also. Okay. And these are associated with common warts. 1 and 4. HPV 1 and 4, they associate with what, guys? Common warts. So HPV 1 and 4, common warts. 6 and 11, genital warts. 16, 18, most commonly associates with the cervical cancer. And 31, 33, also the cervical cancer. Okay. Now, why does this cancer happens? Because certain regions are there, like E6 and E7. They are the early regions. This E6 leads to the loss of which particular gene, guys? P53 gene. Okay. And this E7 leads to the loss of what? RB gene. So one is P53 gene and one is RB gene. This leads to the loss of P53. 7 leads to the loss of RB gene. That is the retinoblastoma gene. Okay. And P53 and RB gene, what they are? They are tumor suppressor genes, and their loss is happening. So obviously it will lead to what? Cancer. And one of the cancers is this cervical cancer done by what? HPV. It can also lead to anogenital carcinomas. Now, can you tell me invasive cervical carcinoma, does it come in the HIV stuff sometimes? Yes. When the CD4 count falls critical levels below 50, invasive cervical carcinoma, they also ought to happen, along with the lymphomas, CNS lymphomas and all. Remember that statement also. Might come. A patient is there with a painful vesicular vesicular genital lesions, and the painful vesicular genital lesions points towards what? Herpes. And the drug of choice of the herpes is acyclovir. Antiviral drug, acyclovir is the drug of choice for this particular condition. Now, an adult male patient is there with a history of unprotected sex. Few months ago, presented with rashes over the palms and soles. Rashes over the palms and soles, they come in the secondary syphilis. Choose the ideal lab test to diagnose this particular condition in the secondary syphilis. So answer is serological test. Okay, and what you go for, guys? You can go for VDRL, and to be more specific, you can go for FTA-ABS, you can go for TPI, you can go for TPHA. All these testings can also be done, but all of them, they are what? Serological test. Zang smear is being done for herpes, simplex virus 1, 2, and even chickenpox. And there is a formation of Zang cells, multinucleated giant cells. KOH wet mount, that is also being done. That is the fungal one which is there, the KOH wet mount. Fine. That is the KOH wet mount. KOH wet mount, whenever you hear about KOH, the fungal etiology should come in your mind. The skin biopsies also can be done. Obviously, it is also more towards the fungal stuff, skin biopsies and all. So here we go for the serological test. The enteroviruses or enterovirus, which does hemorrhagic conjunctivitis. If it is a single-handed question, the best answer is enterovirus 70. And if it had been a question in which double options were there, like with the 70, you have the Coxsackie virus A24 also as one of the options, then both are correct. Okay. If single-handedly, the enterovirus 70 will be the best answer. And if both are there, then A24 and enterovirus 70. They are the ones which strongly correlates with acute hemorrhagic conjunctivitis. Okay. You have to take revenge from somebody and you have bloody eyes 24 hours a day, 7 days a week. So enterovirus 70 and 24. Now talking about this, a child with anal pruritus and microscopy stool examination of the egg is pathogen is shown below. Choose the correct pathogen. We already have done this particular question. It is regarding the Enterobius vermicularis and it is having this sort of egg, that is planoconvex. Fine. So with this, we have ended up with this particular discussion of ours of the INI-CET. And this particular exam of INI-CET definitely tells the importance of microbiology, because the microbiology contributes around 40 to 50 questions. You will not imagine that, because we are integrated with every other subject. In the ENT, in the ophtha, in the medicine, in the surgery, in the pedia, everywhere what is there? Microorganisms, and they does the disease, and related to them, like in the PSM, number of things related to the PSM also of us. So in total, effectively, if you read the subject proper, you have a command over 40 to 50 questions, and that's a huge number. Okay. So very best of luck for your NEET PG exam. Do revise them before that. Definitely from here also a lot of questions might repeat. And don't lose hope. Okay. Always keep trying, give your best, and don't regret. Thank you so much.